Hi, Jenna. How are you this
Hi,
afternoon?
I'm good. I'm good. I'm so happy to be here.
Well, I am particularly proud of you because, if I may gush, you were my consultee. So,
Yes.
congratulations on submitting all of your information to Emdria. I'm just going to do a brief introduction and then I'm going to let you get on your way. So, Jenna Cohen, who is coming to us from Connecticut, is an EMDR therapist specializing in perinatal mood and anxiety disorders, birth trauma, disease illness management, chronic illness, chronic pain, terminal diagnoses, medical trauma, caregiver trauma, grief, and loss. She is a licensed clinical social worker and PMH-C with advanced training in EMDR with yoga, movement, and expressive arts therapy. She began her social work career at a nonprofit and began working in private practice um, about a year and a half ago. And this is kind of how Jenna and my lives intersected. So Jenna found um, Dr. Mara Tesler Stein, who is the founder and director of the Touchstone Institute. And we are doing today Tuesday Tea with Touchstone. So we specialize in perinatal birthing person uh, trauma therapies and different modalities, including EMDR and brain spotting. And we had Jenna in a training a while back. So, Jenna, I'll let you tell the story of how you found us and what you developed for our for our birthing people in Connecticut.
Awesome. So I was just very lucky. I did a Google search. So I knew, and I'll get a little bit into that. Yeah, let's go back to the first slide. So Tane introduced me. Thank you so much. And I would absolutely not be here without Touchstone, without Mara, without Taina, my mentors, gurus, and cheerleaders. So I just want to say a special shout out and thank you. So my story and how I found this amazing training, this amazing group. So I was in a completely different field before. I was in business, I was in fashion, and I was completely burnt out and knew I needed to do something different with my life. Like many of us here, I had my own very significant perinatal and maternal mental health trauma. I lost my first child a few days before she was born, full term. Stillborn, and had another series of successive losses and traumas. And my experience, I'm sure, like many of us here, especially back, 15 years ago, was there was no help, there was no outreach. I remember the social worker in the hospital. I was in complete fight, flight, and freeze trauma, didn't know what was happening, and I asked if there was any resources, and she gave me a pamphlet and said, well, you can just call this number. And I was just sort of left suffering and in just a complete state of trauma for a very long time. I was lucky enough, eventually, after a lot of my own searching, to find an amazing therapist who specialized in grief and loss, and found an amazing therapist through Mount Sinai Hospital. I was in New York at the time, who was running a group for individuals and couples that had lost babies in the perinatal period. And those two experiences changed my life in ways. I would say the help that I received, the support, changed my life in ways that I could never, ever imagine. And I knew from that moment on, once I realized there was help and I could start feeling better and I could start living again, I knew I had to be able to help other people find that as well. That as hard as the loss, the traumas were, that you can live again, you can find joy again, you can find a place for your grief and your love all at the same time. So I went back to school, got my MSW in social work from Columbia, became a licensed social worker, and I started my career at an agency, child and family agency in southeastern Connecticut, which I am beyond grateful for. I did my internships, my first jobs there, learned so much, had such amazing mentorship. But I knew all along that I wanted to get into perinatal therapy. And I also, along the way, I forgot, I had also found a therapy, an EMDR therapist, who I would say made the next huge shift in my life of, I think when I talked about how to live with grief and how to, we all know that, that feeling of trauma in the body, right? That never leaves, those intrusive thoughts, who helped me just shift that dramatically. And so I knew with each step along the way, I knew it was like, perinatal EMDR therapist, that is what I have to do. And I got to a point in my career where I had enough years and enough experience under my belt as a therapist. And I said, I'm ready. I'm ready to do this. And I just started Googling, and I joined Facebook pages. And I was lucky enough to be recommended and come across Mara's introductory basic EMDR that was focused for perinatal therapists. And I took this training course, and it was incredible. And as I did it, I said, this is not enough, right? Now my next goal is, how do I reach people, right? How do people know to come to me? How do people know to come to Child and Family Agency? How do people who don't have the resources, who don't know like I didn't know that therapy in this vein existed? And so I wrote a proposal for the agency that I worked for about getting me additional training and about doing outreach. And it was very, very grassroots. I really didn't know much about grants. I didn't know much about putting a program together in the perinatal world. In my business world, I had put programs together, so I knew it was possible, but I did not know how to do it here. And I was lucky enough. So a lot of this is luck, and a lot of this is just keep going at it. I wrote up a big proposal, and the agency said, well, this is perfect timing. We apply every year in Connecticut for this Women and Girls Fund. And so I wonder actually if we can move to the next slide. This is going to talk a little bit about the funding. They said, well, this, we're a nonprofit, we don't necessarily have the money for this, but let's see what we can do. And there was a Women and Girls Fund. Connecticut is amazing and has this fund. I think you can get up to $10,000 per calendar year. It's small, but it's enough to get started. It's called the Women and Girls Fund, Community Foundation of Eastern Connecticut. And we applied. I wrote a proposal, and our grant writer helped put it together and make it pretty. And the goal was to get a group of therapists trained in perinatal EMDR with Mara and her team, and allow for money also for outreach, because we could, as we could have lots of people trained, but how are we going to get people in, right? How are we going to get, especially what the goal was to get families, birthing individuals, people that did not know this existed, didn't have the financial resources, or perhaps the informational resources or the insurance resources to be able to come in and get services. So part of the money, and this is one of the things when we think about innovative funding, right, is how are we going to use this funding if you only have a certain amount, right? And so it's sort of trying to figure out, okay, how much is it going to cost to get people trained, and going back and forth with Mara and Tiny, and I'm like, okay, this is the group of people that I think I have, and getting them trained. And then also, how much money, what is it going to look like to do outreach? And again, very grassroots. So I ended up doing outreach with OBGYNs, midwives, pediatricians, DCF, visiting nurse services, really anyone that I could think of that might be working with a community of people that are thinking about getting pregnant, are pregnant, have experienced pregnancy, or are in the postpartum period. That in particularly also maybe have a lot going on in their lives, right? And how do we reach them in a way that's also convenient and going to be workable for them, so that these supports work in their lives? So I took this little blurb actually off of Child and Family's website. I was really excited to see it. So CFA was the first agency in southeastern Connecticut to provide these services. We called them perinatal maternal mental health services. And we were awarded the grant for 2 years in a row. I wonder if we could switch to the next slide. So I talked a little bit about where the funds went. So I'll just talk a little bit more about that. And as I said, so some several went for outreach. I did several meetings. I had meetings with DCF, meetings. I cold called, doctors' offices, sent flyers, had meetings with them, arranged the trainings. And then as our newer clinicians were getting trained, right, did a lot of internal support for these clinicians, did internal consultation with them of what it looks like, to kind of begin to transfer to how you start thinking about things through the perinatal lens, which I learned so much from Mara about, right? Because these are trained clinicians, but have just begun their training in EMDR and just begun their training in the perinatal and maternal mental health field. And so how we sort of start to shift that lens, especially for people at child and family agency, we're much more looking at more developed families, I should say, with kids that are older, is how do we start to shift our thinking to, which you all do on a regular basis, right, of the pregnancy period, right, the perinatal period, where we want to get in there and work through the trauma before these kids are ever born, right? Or we want to get in there and work through the trauma with the individuals, with the parents, with the families, right after or when the trauma has happened, whether it's birth trauma, postpartum, perinatal mood and anxiety disorder. So sort of helping people to shift that lens together. And lastly, before we get into more conversational and questions, I just want to put up maybe a slide. This is just to give some people some ideas. This was a pamphlet, the flyer that I put together with the help, I should say, of our grant writer and artistic person, really just sort of, and sent it out all across the board to different doctors' offices and so forth of what the services could look like. And I'd say this is in the very beginning, so it has evolved, but just sort of grassroots, I think what's really important. Sometimes we think we have to step into something that already exists. But as therapists and EMDR and perinatal therapists, we have all the clinical tools, right? So how do we just get started, right? And I think a lot of it is like Googling to look up grants, reaching out to connect to people, making a flyer, right, of these are the things that I can offer, and trying to connect to people who might be really responsive to that. So that's sort of in a nutshell. We can have a lot more conversation about what innovating funding looks like. And I know Tiny is going to have some great questions for me about roadblocks and obstacles, things that I made that I thought went well, things that maybe I would do differently, why my focus has shifted and changed to where it was. So with that, I end my brief early presentation, and I look forward to chatting with Taina more and any other questions that come up.
Yeah, so Jenna, thank you so much for that overview. And so my first question is, I took one grant writing course when I was in my MSW program, and I'm not going to tell you how long ago that was.
I'm sorry, is it okay if we just take down the slide? This way I can just see you.
Yeah, absolutely. So what does this look like for people who might be hesitant because they were not specifically trained to write grants, but they might have a passion for perinatal mental health or whatever specialty that they're looking at?
So I think that is such a great question, right? And I was lucky in this case because I did have support of someone. I was sort of put all the ideas and services, but I did have support in that. But I think I learned a lot of what I would do, and I'm sort of thinking of my next venture, right? Of what I would do, how now would I go about that? And I think what I learned is that people in the grant world overall, they want to give money, right? They want to find places to put their money to help. They're in this because they want to help their community, right? So one of the places that I've done some other research of my own, is just Googling local grants, right? I think particularly as opposed to there's bigger federal grants, right? Tend to, I think, have more red tape and more paperwork, and there's bigger dollar amounts, but starting with some smaller grants, right? So figuring out what it is, who do you want to serve? Who do you want to reach, and what do you want to do with that money, right? And finding someone that's going to fit that, putting your idea out there and seeing who launches them. Because if you start going with other people's grants and then having to try to jigger your own services or your own passion into that is going to be a really hot mess. But if you can put together, and it doesn't have to start with anything fancy, right? Because we're talking about people, especially on the smaller sides, if we're starting smaller with reaching out there. If you can write a paragraph or some bullet points, right, or a couple paragraphs of what it is that you're looking to do, right? Start Googling, looking out for local grants, and just ask the person, is there someone I can talk to there, right? I have this idea. How do I go about submitting this? How can I hear about how you work? And I've set up several meetings, and people are they really want to talk to you. And they're generally really helpful. And the places that are so busy and have so much red tape, you don't even want to go there anyway. And again, this is all my personal experience. So take that with a grain of salt. And you'll learn a lot on the way as you do it. And then there's always Googling forums of what does a grant look like? You can pull up on a lot of websites, also organizations, you can pull up grants that they've submitted so you can see the formats, right? Because if you're going grassroots, you're like, I can't learn everything. What's already out there that I can, so I don't have to reinvent the wheel. But I would say my number one thing is know what you want to do, and find a funder that wants to fund that'll fit into that.
I love that. And speaking of finding the funder and finding the partners, you mentioned DCF, but we're in Connecticut. So for our watchers who are unaware, and in their states it might be called something different, can you just elaborate a little bit more about the partners who chose to work with you?
Yes, absolutely. So DCF in Connecticut, that stands for Department of Children and Families. For a lot of other states, right, it's CPS. So they were a great supporter and have been a great funder, and were a great outreach, because they really are, their ultimate goal is providing, as we know, like safety and protection for children, right? And so one of my pitches, right, and one of my beliefs in this, and I think probably everyone who's watching this is a big believer in why we do this work, right? If we can address the trauma, right, prior to or during pregnancy or in the early postpartum phases, we are going to really protect those children and protect their homes, protect their families, the integrity of their family, right? And so my experience with agencies, right, federal and state agencies such as DCF and CPS that want to preserve families and protect children, it was not a hard stretch, right, to understand that concept, right? And a lot of people, and I think a lot of people there see that already, right? If we can get in early, the whole idea is getting in early. So that was one great partner that we worked with at Child and Family, and the partnership was referrals, right? So the referrals, so we got referrals from DCF or CPS, or Department of Children and Family Services. There was also referrals from pediatricians, OBGYNs. And I'll tell you, so something that I discovered, so for people who are working in this, and I'm going to talk a little bit about some ideas that I have, because my goal here really is not just here, but to inspire people, right, for your passions for outreach, for serving, for finding and supporting people in our communities, right, who need these perinatal and maternal mental health services and don't necessarily have, when I say access, it could mean a million things, access to it, right? I found with, let's say, like OBGYN offices, right? One of the big reasons they would refer, right? And this was, it shifted at first. We were providing psychiatry services as well when I was at Child and Family Agency. So OBGYNs, they don't mind starting the Zoloft, the Prozac when someone is postpartum, but they don't want to keep it up, right? So if you are a therapist and you have a close relationship with an APRN or psychiatrist or a med provider, you're going to get a lot of referrals, right? Because the OBGYNs, in my experience, they love to refer for therapy and medication, because then they know their patient is taken care of, right? So a partner like a DCF or a visiting nurse services, right, who may take care of young birthing or pregnant people, right? They're really looking for more emotional supports, right? Because while they're doing the nursing services, but they also find that they are doing a lot of supports in the mental health world, because nurses do a lot, right? But they don't necessarily have time to do all that. So if they can find someone that can help provide that mental health support for them, and they know that their patient is covered in that end, you're going to get the referrals from there. So those were two things that I really saw when you sort of think about what your practice might provide to someone else. And that could be an individual practice, a group practice. It could be you work for an agency. And like I was at an agency that was very focused on children and families, right? So these were children that were already, in a lot of cases for our outpatient programs, right? The children were 3 years and up and their parents. And so there was a whole missing section in the perinatal period, right? And so bringing that in. So finding, if you work for an agency, finding where the gaps are in there, or if you are working in your own practice or a group practice, right? Where might you get referrals from, right? And what kind of funding do you need to make that happen? And who is that going to appeal to?
Jenna, do you have any reflections when you think about the transition from agency to private practice? What special considerations can be for grant management and how those relationships can kind of continue to provide the quality of care that you've been specially trained for?
Well, I first want to talk a little bit, if it's okay, Tayana, talk a little bit about some of the roadblocks and obstacles about
please.
Yes, working at an agency, right? And again, I say this with the most love and respect and admiration for the agency I worked for, right? But each agency or organization, they have their own mission, right? They have a mission statement, right? And they have to stick to that, right? And so I came in, right, with my own mission. My mission was perinatal maternal mental health services, right, during the perinatal.
I love it. I love it.
Right? So, and understandable. So what can happen is if your mission is different, a little different than your agency's mission, my mission folded in, but it wasn't what they needed to provide, right? So, and this was in the middle of COVID, right? And as we know, children and mental health needs skyrocketed, right? And that is the number one, and they had to stick with that, right? So the sort of the perinatal stuff, unfortunately, fell off a little bit. So I ran into a lot of roadblocks, right? Of how I'm not getting the time I need. I can't get clients in because we couldn't take any more adults, right? So kind of knowing, right, what are your obstacles and limitations going to be when you're at an agency or another company, whether it's a private or public or nonprofit, of how is my mission going to fit in with theirs? And so that was where my roadblocks landed. It was like, I could bring a whole ton of clients in, but I didn't have any therapists or spaces to fill them because everybody was booked with kids, right? So that was a big roadblock for me. And I think also making things happen quickly, right? Sometimes I call it like turning the ship of like the Titanic or something like that, right? When you are a small company, a small organization, you can be a lot more nimble and turn quickly, right? When you're a big organization and you've got to go through 7 different sources to sort of get someone signed up for a training, right? As you guys, Mara and Tiny, you might know, I'm like, we're going to this training. No, wait, it's going to the next training, right? So those were a lot of obstacles. Making things happen quickly and staying on the mission that I had, right, were huge obstacles for me. And I think, it came to a point for me where I know clearly what my mission is as a therapist, right? And it's continued to evolve a little, but perinatal and maternal mental health is a big driver for me, right? And so eventually, I started dabbling in private practice. I joined a group private practice where I get to take on all perinatal maternal mental health clients that I want to, as much as I can fill my schedule. I have also started my own private practice where, and I can, if we're interested, we can talk more about this later. I'm doing intensives, which that is actually where I'm really interested in working on funding, on looking at outside funding for that, for doing intensives for people who are pregnant, because we're talking about more of a crunch timeline, right? That don't have the financial resources, right? Or have the knowledge of how to find that, right? So that I can talk about next. That's sort of that's my next agenda that I'm looking at.
I really appreciate the reflection that for smaller organizations, it might be easier to pivot than for people who might be a much larger organization that have to answer to many people.
Yes, exactly. Many people, many boards, many funders, many directors, right? When you're an individual or you're at a smaller organization, you decide, what, we're going to focus on serving, we're going to make really close ties with the local hospitals and birthing centers around us, right? And that's what our outreach is. And we are going to make those clients a priority, and we're going to get them in, or we're going to make a relationship with a hospital where we can go in and meet them first personally, right? While they're in the hospital and they come out. Like, you have all these different ways that you can, as you said, sort of shape the way your client interaction works.
I love that. And what would you count as some of your biggest? So you talked to us about some of the organizational challenges. What can you tell us about some of the takeaways in terms of pride that you have and accomplishments that you have achieved with getting this grant in for your clients?
Yes. Oh, actually, I'm going to go back to one more thing. It's okay. Something that I did not mention, which is something that's really important when you are working with grants, and EMDR works beautifully for this, right? Is having, God, why am I blanking on the word? Results, right? They want to have results, right? So something that we established was we did the PCL5 on intake. And now we did the PCL5. The goal was to do it every single month. And for those that don't know, right, that's a trauma screener. Really simple, fast, and easy to do. But the big thing was on intake and discharge, right? And if we can show difference in the numbers, right? A reduction in the trauma symptoms and a reduction in the number of that's the significant data, right? So it's how many people, and it depends on what the goal, right? How it's set up. But for this one, I think it was how many people that we saw and a reduction, right, in their trauma symptoms, right? And so it was really easy for us. So I would say also as an individual, when you do set up, make sure you have a really easy trackable way to be able to show your data after. And so it might be for you number of clients, right? It might be for you clients from a certain income or community, and always just picking a fairly simple, screener to use, like the PCL5. Maybe there's another one you like better, right? And do that before and do that after. And obviously you can do it as many times during, but that'll be a really big thing. So, and I'm sorry, Tana, would you mind asking
No,
that?
I love that. And I think that that's one of the reasons why you have been successful, right? So having measurable objectives that can prove, especially to funders when we're talking about innovative funding, is what does it look like to prove, right, to them that somebody is getting better. And I think that sometimes as therapists, we get lost in the weeds because we want the client to be 100% better, but recognizing that 10% is 10% better than it was. So I love that so much.
Exactly.
So in terms of how this has impacted your clients, what are you thinking about that, and what comes next?
Oh, I mean, the impact has been huge. So I'm going to talk about impact in several different areas, right? So first, just the outreach. I'm just going to talk about the organizations and people that I collaborated with, right, that I ended up getting referrals from, meaning, right, Child Protective Services or Department of Children and Families, doctor's offices, OBGYNs, visiting nurse services. There are so many of people and organizations that had never, first of all, didn't know what the perinatal period was, hadn't heard of it, right? Hadn't heard of EMDR, right? Didn't know what PMADS was, right? So they could never even explain these things. They couldn't look for them, couldn't explain. So there was a lot of education with the people that I collaborated with. So I would say one huge impact was the ability for the people that I worked with, right, to be able to say, I recognize this, I see this, right? This is what must be happening, right? Oh, it's not just postpartum depression. There's postpartum anxiety. There's postpartum OCD. Oh, and there isn't just therapy, right? There's all different kinds of therapy, right? So I think that makes me feel, right, as a clinician, and as an advocate, makes me feel wonderful of just having more advocates out there, right? And more screeners out there in general. So that's an effect that, of course, that goes down to the client as well. And then I think on my clients, for them as well, a lot of them, I would say many of them heard of postpartum depression and postpartum psychosis. They thought maybe they were going to develop postpartum psychosis from postpartum depression, especially with everything in the news. So a lot of confusion, right? And people, I think, that didn't necessarily have access or education about the perinatal period and what that means, right? Or what trauma looks like, or even how to go about getting a therapist, or knowing that there was help, knowing that taking medication, right? That it's okay to think about taking medication when you're breastfeeding, right? That therapy wasn't something I'm doing because I'm bad, right? Because there's stigma against it, right? But that this is an amazing thing to do for myself, and I can feel better and hope. I had a lot of clients who come to me, as we all know this as therapists, right? That we get someone in we're talking about a perinatal trauma. And of course we uncover, something that happened when we were there 4, 5, 6, 7, 25, right? All this stuff, right? So that's the normal work, right? But a lot of times people who will seek out private practice often have been in therapy before, right? They know about therapy, they know about trauma. A lot of the clients that were able to be referred to me had no idea about the impact of trauma, had never been to therapy, thought therapy was a dirty word, right? Like all these things. And I will say the experience of seeing for them, right, what therapy has brought to their life and the change that has brought, and then their ability to share that with their family and their friends, right? And how many people that I came in who would have considered doing therapy before, right? And then are referring their friends to come to do perinatal focused EMDR, right? So I get the chills thinking about it, right? Because that's the effect, right? So we have the individual work, but with this funding, with this program, the beauty of it is the cascading out of that.
I do want to give a shout out to Postpartum Support International and their perinatal psychiatric consultation line, because there are so many people who still function. I'm quieting a small child, who still function under the belief that pregnant perinatal people cannot take medication. And that pregnant people in the postpartum period cannot take medication. And I think it's always important for us to share that tool with our colleagues.
Yes. And I became, during this, I will also say, so PSI, I collaborated with them, went to several of their meetings, are a phenomenal partner. I'm sure a lot of people here have worked with them and know them, are on their committees and so forth. But just reaching out to anyone there and asking questions to them, right? They're just another great resource, like asking questions to them about grants and funding, and who do they think, like if you're like, I want to do this, but what is the community that I should reach? Who's the head of your PSI chapter in your city or your state, right? Ask them. They might have a great idea of who needs services and aren't getting them. And that's a great place to start for looking for your own funding or putting together your proposal for your funding. And I just think the sky's the limit, right? So we think about we're all here because we have a passion and expertise in working in the perinatal and maternal mental health field. But, even before in our conversation earlier today, we're talking about chronic illness, right? We're talking about that, but there's so many things. You may have other areas that are also really passionate about, right? What areas of those that you're passionate about are underserved too, right? That you might want to do something creative with. You're like, I'm not getting clients in that area, or I want to reach those clients that I might not be able to or might not have access to, right? So I think that this is my experiences in the perinatal field, but this could really be anywhere, sex
And I
trafficking.
love, yes, that I love that conversation about intersectionality. So what does it look like if somebody was pregnant and they were sex trafficked? What does it look like if somebody has a chronic illness and they are pregnant or are dealing with parenting post-birth? What does it look like for specific populations who are more likely to have experienced sexual abuse, sexual trauma, right? All of those things are very real. So I appreciate you bringing that into this space. Even the conversation, nationally about who is most likely to have mortalities around birth. Like,
Yes. And I would say, there's things, if there's often tend to be sort of like hot and button issues in the news, right? That come up, right? Let's look around, statistics of mortality, pregnancy and birth mortality. That's another place to start too, right? If you know that your local government, like there's a lot of talk around that, well, that's another place to think about, okay, clearly like the community, the state, like is behind this. They want to make a difference. Maybe that's a great place for me to start, because that means they might be putting some money and some funding there, right?
I love that. Would so do you have any final thoughts in terms of how people who are looking at what you did and are really interested can move forward? Also, do you offer consultation around this topic? Because I think that for some people, there will need to be, I always say, and I've been doing this for quite some time, like I'm always getting consultation because I am not a perfect person and my colleagues are so brilliant. But what does that look like for you in the model that you offer?
Absolutely. I'm absolutely available, and I would be honored to provide consultation, to help provide any connections that I might have that someone's looking for. And I wonder if I can put my email in the chat, but I would 100%, you can reach out to me for consultation if you have an idea, and that could be brainstorming, right? Of, I have this thing, but I'm not sure what it is, of trying to put it together on paper. It could be, I've got it all written down, but what's my next step in reaching out, right? Or I've got this, but how do I want to, what are the roadblocks I'm going to, run into, and how do I want to set up my office? Or a big thing is, I've got this funding. How do I want to split up the cost, right? How do I want to split up the money, right? And, how am I allowed to spend it? And how much do I want to put in each area? Right? Because I think that's a really big thing. And am I working with clients that take insurance, that have insurance, right? That have Husky. So when I say that, so one in Connecticut, we have very comprehensive, good mental health state insurance. That especially during COVID was easier to get. But does my state have good state insurance, right? So that's one thing. So, or do I need this grant to cover the payment? So I think that's a big thing too. And how much is that going to cost? And how much money do I need to get paid for myself to do this work? Because that's a really, really important component as well, right? You need to take care of yourself. You should get paid for what you do, and you want to be able to keep going, right? So all of those are big pieces that I can help consult on.
I love that. And Jenna, can you tell us, were there any Touchstone trainings in particular that were helpful with moving you into this direction of helping the perinatal birthing person space?
Can I just say all of them? So I've literally done all of my trainings, all of my consultations. I may be a little bit of like a junkie with you guys, but no, but in all seriousness, I will say, so I did Mara's intro EMDR that was focused really for people that were perinatal or maternal mental health therapists or wanted to be. I was not at the time, and I felt very, very welcome just having an interest, right? Like, which was beautiful. And then I did her advanced training. I also did, which is an offshoot, I did a yoga and movement one with Jamie Merritt, which was also really helpful because I think, pregnancy and maternal mental health is so much in the body, and that really helped to expand and I'm not talking about like crazy downward dogs. I'm talking about breaths and yoga, breaths and movements into body, and combining that, right, with all of that I learned from Mara and from you in the perinatal, focus lens. So I would say any single training that Touchstone offers is pretty flippin' awesome. But I would say, the first one, just the welcomeness of it, of you guys in the community, and that this passion is real and people really need this work. That was like, that solidified my, oh, I can do this. Like, this is really a thing. So I highly just recommend it. Recommend them all.
Thank you. I did not pay you to say that. And
Nope.
and what I think is really interesting about the perinatal community, and one of the reasons that we do these Tuesday teas, is we went through a rough couple of years where it was hard for parents, for birthing people, for anyone raising children to have that community, right? We were locked away for quite some bit. So even creating community amongst the therapists, the medical professionals that were treating these people, and really, when you say take care of yourself, like that was a time when we were all pitching in to help take care of each other. So I appreciate that that reflection, because it has been, and I hope it continues to be, a place where we can continue to support each other.
Yes. Absolutely. Absolutely. So I guess some of my parting words is I hope this, like, my true hope is that this inspires more people, even one other person, right, to do something creative with their funding, right, to reach more people that need our support, right, and collaborate and get our services out in a really creative way that works for you, to help more people feel better during the perinatal and maternal mental health period. And I'm here for collaboration, for consultation, for questions. And I thank you so much for allowing me to have this space to share this, because my dream is that every nonprofit is going to have a perinatal and maternal mental health focused division to it, right? And that people are also going to start their own practices and maybe come together with groups, right, of med providers and therapists and Reiki's, whatever it is that's your thing, right? And we are going to support our pregnant, thinking of being pregnant, struggling getting pregnant, postpartum community out there. So
Thank you, Jenna, for bringing your time and energy into this space. We really appreciate you. We appreciate the work that you're doing in the community. Again, for everyone, this is Jenna Cohen. She is based in Connecticut, and she has done some pretty awesome work around innovative funding. So if you would like to reach out to her for any type of consultation, feel free to do so. The link has been shared on the screen. And we thank you for joining us for another Tuesday Tea with Touchstone.
thank you. And when I have my next innovative funding, I'm no longer at the nonprofit agency, I'm in private practice. When I have my next one more solidified, I'd love to come in and share it with you guys.
Please do. Please do. We would appreciate it. Thank you.